started. Okay, so today we're going to practice doing the audiometry, the pure tone audiometry on each other. This is a PC-based audiometer. So when you sit down to the computer, you're going to need to go to the plus right here with the person, and you're going to add a new patient. So whoever's going to be tested first, give me a name and I'll go ahead and put you in. Who's going to be first? Melissa? What's your last name, Melissa?
Davalos.
Spell it for me.
D-A-V-A-L-O-S.
Okay. Can't type today. E-L-I-S-S-A. Did I spell it right?
Yes, ma'am.
And birthday?
2/4/99.
So put your patient name, date of birth, and then okay. And then you're going to go into AutoSuite. Click right there, and that will take you into the software. So I was just discussing this with the class, but you guys get to hear it again. This is a control panel, so you actually have the option of doing the test with the control panel or using the keyboard. This is a PC-based audiometer, so it's pretty high-tech. As far as equipment goes, we have high-end technology here. We've only had this equipment for about 2 years here at Eastern. So now you can see this looks very similar to OddSim, doesn't it? So when you're practicing, you're gonna do it the exact same way. Your arrow keys move, change your intensity, not your intensity, I'm sorry, changes your frequency, left and right. The up and down arrow is how you change the intensity or the volume. And then you press S to store the threshold once you've obtained threshold. You use the same technique that you've been practicing in OddSim, okay? Now notice over here on the left. Right here, you're gonna see the option to pick your transducer. So you have to choose, are you using insert earphones? The phone means headphones. High frequency is the special high frequency audiometry headphones. We won't be using those, but if I was, that's how I would select. When you're doing bone conduction, you're gonna click right there on bone. Speakers is for sound field testing. And then you can choose left or right on how you're going to, which ear you're gonna test, or you can also come up here where the ear, and you can toggle back and forth between left and right. Now, one thing to be cautious about, if you'll notice I'm on right ear now, when I click it again, this is actually binaural. You don't wanna test binaural, you wanna test ear specific. There are some tests that I do for APD that involve presentation of sound to both ears simultaneously, and that's what I would do. But for the purposes of this class, you're gonna just do right and left. Once you've got that selected, your stimulus should be on tone. This is a 2-channel diagnostic audiometer, so it's different. The one that we're using for screenings is just a 1-channel audiometer. Okay, we need 2 channels because if we were to mask, then I would operate this second channel separately so that I could introduce that masking noise into the other ear. And just to show you, you're not going to be masking. But what I would do if I was masking, say I had threshold right here, I would turn the masking noise on here to the other ear, adjust the sound, present the tone, and then store it, and then it would store it automatically as a masked threshold. And then you can just print these results instead of having to manually write them down. Okay, so then just a quick look here at the control panel. I want you to practice doing both. So I want you to use the computer to do one ear and then go to the control panel to do the other ear so that you get experience with both. Same thing, you just kind of have to get your bearings, but the frequency is here, the buttons from side to side. Talk forward is this button here in the middle. What that means, and you'll need to wear this headset while you're testing. And there's a microphone in the booth that allows you to communicate with your patient. You're gonna hear them regardless whether it's on or not, but if you want to talk, you're gonna push talk forward, and now my patient can hear me giving instructions through their earphones, okay? If you wanted to do that here, talk forward is this green button, this speech balloon right here, and now my voice goes to the patient so that I can provide instructions. I want you to remember you need to instruct your patient prior to putting the insert earphones in, And even though you all know what you're doing, you're going to instruct your patients just for practice, because you're always going to feel silly at first saying it until you kind of get a fluid, instructions to use. Let me see what else. Oh, so this is the intensity. So you're turning the dial up and down to change intensity. Frequency is here, and left and right. You'll see routing is right here. It's already tone. Right here under transducer is how you're going to select whether you're doing bone conduction or insert earphone. And then store is right here, this button on the left. So you will push store when you're ready to mark that threshold on the audiogram. Okay. Now when you press, one thing I do when I'm testing, pretty much when I'm doing my first threshold search, once I find that first level, a lot of times I'll go ahead and store it just so I know where it was, and then I'll go ahead and go up, present, present, present. They got it again. Oh, that's 2 times. Now I'm going to do it again. 3 times, it's done. Okay, now what if they didn't? What if they, gave it to me there first, went there, oh, no response, so I got to go up. I got it there this time. I can move it just by pushing store again. Okay, so it's not permanent, and you can even right click to delete that if you store the wrong symbol. Okay, are there any questions about using this computer? You will put the reliability here. Your options are good, fair, poor. Everybody in here should be good as long as everybody's behaving. You can also click right here to mark the severity, which is kind of cool because it gives you a cheat sheet when you're looking at the degree of loss. Then you'll be able to know. So I'll leave that up for you guys to look at as well. Another thing that you can practice with if you want to, right here you'll see pulsed. So if I click that, can you hear it's really soft, but can you hear that's a pulse tone versus the steady state pure tone. Who remembers when we would use pulsed presentation? Very good. For tinnitus patients. If they have tinnitus or tinnitus, both words are used, and it's okay. If you have a patient that is really struggling with tinnitus, then you can change it to a pulse tone, and that just helps them sort of grasp the sound that we're presenting over the tinnitus that they're hearing. Tinnitus, if they have it, will usually get worse during testing because they're quiet. It's a quiet room, and they're concentrating on really soft sounds. Okay? So that's how you do it out here. One other thing I want to show you is otoscopy. We have the video otoscope, so you guys get to practice with this as well. Somebody said in the yellow chair for me, and I'll demonstrate. Whoever wants to have their ears on TV. Somebody? Nobody?
I will.
Oh, good, thank you. So you'll put, I've got Germex for everybody, and I just did it, but I'll do it again. You'll put a tip on the end, and then just like, push it on there, just like the otoscope that you used, this is very similar but much higher quality. You're going to pull up and back on the ear, shine the light down in the ear, and make sure you're bridging. But you could see she has tiny little ear canals. Her ear canal's clear, and then all the way in the back I could see the eardrum kind of shining back. And then I can actually take a picture and store it in the file for the patient. Now I'm going to do the left ear. Remember to always, always bridge. And you have to kind of practice holding it because you have to hold it stable and then push the button. It takes a little bit to actually record. Okay, so you can practice with that. And then I'm going to leave this tip on there for whoever's testing her so that way you guys can use it. And now we'll go into the test booth just to show you what it's like on that end. So start with otoscopy, then you'll go back to audiometry, adult audio. That's how you switch back to get to the screen to do your pure tone testing. Now to go into the test booth. Melissa, if you'll come in here. You're going to have your patient sit right here. Normally we have a response switch that I would give the patient as long as they're, I would say, at least 10 years of age, because you don't want the kid just like banging off the walls and hitting the button every time. That gets kind of annoying. But if you look at the screen there, you can see that every time the patient responds, the green light lights up. And that just is a quick way. We can try that today. My switch has been acting a little funny, so see, like right now it's not showing up. Yeah, we're not going to use it. We're going to raise our hand. It's intermittent, and that gets really annoying because test results aren't as accurate, so we're not going to use the response switch. You're going to put insert earphones. You're going to use insert earphones on your patient. You got to make sure that you insert them properly. So provide your instructions first. You're going to tell them I'm going to place these insert earphones in your ear. You're going to hear lots of beeps, and I need you to raise your hand for me every time you hear the beep, even if you just barely hear it. Put the insert right here on the end. Now, one thing you have to be very cautious about, when you pull this off, you cannot lose this white piece right here. Don't throw that away. It's very expensive. Just throw the yellow earpiece away. When you place the insert earphones, you're going to roll them up, kind of like if you've ever done earplugs. Roll them up, pull so they're really small, pull up and back, straighten that canal, and place it in the ear until pretty much none of that yellow is hanging out. Then give it just a second while it expands. Do the same thing on the other side. And then she's ready to begin. And then you'll go around, close the door, put your headset on, and start testing. And then you guys, half of you can gather around and watch from behind, and a few can watch in here. Normally I would close this, I would turn this off because I wouldn't want the patient being cued by the screen, but for the sake of learning and you guys watching what's going on, I will leave that on. All right, so that's the end of the video. I'm gonna let you guys get started.